Hi, I'm Dr. Joseph Wittering, and today I'm joined by Sheila Wojo-Rich. And this is the first of an interview series, hopefully one that's going to be on a weekly cadence. And we're going to be covering kind of important topics about drug tapering for psychiatric drugs. There's a lot of content on this page about withdrawal injury and such. Today's topic is more broad. This is for someone who may not have a protracted withdrawal injury. It's still relevant if you do, but it's a more broad topic for everyone. And so I'm going to introduce Sheila. So she has her own long-term SSRI use and withdrawal experience. She's been on a medication tapering journey since 2017. She's also a therapist and a coach, and she's involved in the withdrawal advocacy community, and she's a member of the Inner Compass initiative team, which you may know of. And if you don't know of them, you should go and check them out because they're doing really good work over there, with Inner Compass and the Withdrawal Project and all of their communities. So, Sheila, welcome.
Thank you. It's really nice to be able to chat with you, and thank you for doing the work you're doing too. It's obviously much needed. So we really appreciate you.
Okay. Well, thank you. So why don't you go ahead and introduce the topic?
Yeah. So a question that, often comes up is how might someone set themselves up for success, before they start, if they have the luxury of setting themselves up for success before they start a psych drug taper? What might be important there?
Okay. So one important thing is really being clear about why you are wanting to come off the medication. So, and there's a multitude of reasons for this. You could be in a place where you don't even know if the drug is helping you anymore, and you're just simply, you put on this medication 10 years ago, and you don't even feel it anymore, and you're saying, well, I want to lower my medication burden over time, and I think this is going to help me in the long run.
So maybe curiosity, what, even what's my baseline? What might I be like,
exactly.
without this?
Mm-hmm. And I mean, when it comes to antidepressants and things like that, this could be things like, I wonder what my sex life might be like with it. Because as you may know, there's a lot of sexual side effects with antidepressants. I mean, there could also be weight side effects as well. So you might, it could be, what's my mental baseline like, but what's also my physical baseline like? And
yeah. So, and everybody's why, I have a lot of these kinds of conversations. Everybody's reason is different, right? Everyone's reason will be different. Everybody has a different sort of relationship to the drug. And so we ask people to really sit with, their own relationship to the drug. And sometimes it's, a decades long relationship with this drug. It's like a relationship with a person, right? I'm about to break up with this really big part of my life, potentially. So it can bring up a lot of feelings of doubt, right? Fear, excitement. So it could be really important to sit with those and sort of and feel really grounded into that why I'm coming off for if and when things start to get hard.
Yeah. I love that because that's why you need the why, right? Because it's because it's not going to go, well, I want to say this, but commonly it doesn't go smoothly. It's that's the whole process of withdrawal. It's a steady removal of the drug, which is going to put you into a state of discomfort as your brain readapts to the absence of that. So, the process of coming down, it's, if it's going smoothly, essentially, it's just the opposite effect of the drug. So, we're talking about ramped up anxiety, on the SSRIs, same with the, benzodiazepines, but, there can even be things like paranoia, agitation, irritability. And you need to be so, solid about the why, so you can kind of grab onto it when you're in that storm and it's kind of pushing you side to side, and you can kind of push through.
Yeah,
and
absolutely.
I really liked what you said about, it being a relationship, because a lot of the people that come to my practice, it's like, they're opening a door, they're opening a new chapter in their life, and they're saying, who am I off this drug? can I do it off this drug? Can I be functional at work, in my relationships? Can I handle social situations without it? And it's kind of like this rebirth. So,
I like that. It definitely can be a rebirth.
Mm-hmm. Yeah,
absolutely.
So the reasons why you want to discover life without medication. I mean, a lot of what I deal with is this kind of lingering concern about if you have a protracted withdrawal injury, it's usually when people get to that stage, they're kind of done with medication. A lot of them, they're just saying, I've been burned so hard and I just want to be off, either just for that reason, or maybe they're worried that there could be some lingering damage going on. And it's uncertain if that's happening, but that also can be like a very valid reason to want to come down. Have I missed anything, Sheila? Any other kind of common reasons that you see for people who want to stop these medications?
So no, I would think, I would think about the timing in someone's life of embarking on a taper is something really important. Assessing your living situation, is there a major life event happening right now? Everyone has stress, but is it a period of like significant stress? People going through divorces or, a recent death, or, things like that. I think, the timing, if you, again, have the luxury, the timing is really important to consider.
Yeah, completely. And that's right. Yeah. If you have the luxury, I mean, so in a perfect world, if you have time and resources, some things that you'd want to consider is, can I take some time off work if things don't go well? Do I have family around who could support me?
Right, a support system. Yeah.
Yep. Yeah, and then also it's like, do we have do you have the finances? Let's say you're in a pretty bad place for 6 months or something like that. Can you ride through that?
Right.
Obviously, if that's not something that you can do, there's always kind of FMLA. Well, there's disability essentially.
Right.
There's short-term disability and long-term disability, which can be used as well. But ideally, you don't have to use that if you don't have to.
And sometimes people become so they're really struggling and they need help with finding just practical help with finding, disability information or any kind of information that they might cognitively not be able to figure out or whatever. So if you can think of it ahead of time, like, hey, here are the people who I can trust and who will be part of my team, that I know can help me with this if things get hard, right?
Sure.
Who else do you think would be part of, obviously, a doctor or a withdrawal savvy practitioner like yourself, peers from the community. I always say, right? Find people who've done this, find people who walk the path, talk to them.
And I'd say I guess also it's like the degree of support you need probably depends on where you are when you're starting this. So, we both know, we want to do slow, patient-led, flexible tapers when people are coming down. It's quite possible, that you may not need to take time off work, that you'd be able to come straight through and you're okay. So that's like one group of people. But then
absolutely. There are people who can, they don't miss a step. They're able to taper and slowly and carefully and maintain their life.
And then there's this other group, and people, they know they're in this group eventually. It's like maybe they've already gone through an unsuccessful withdrawal. They're having protracted withdrawal symptoms. Those tend to be the people who they're going to want as much support as they can get. They're going to want to make sure the timing is right if they can, because that's kind of a higher risk group when it comes to severe symptoms. So, if you're in this, so I'd say if you're in the, if you're not having any significant withdrawal problems, I would say what's essential is it's really the prescriber, I think, because you need someone that's going to be able to work with you and do a very gradual patient-led taper. We're talking 5% every 2 to 4 weeks, to find a nice rhythm to go down.
Right. That support can be so helpful. For sure. People do it on their own. People do, but having a practitioner who really gets it, it can make all the difference.
Really, I mean, it's the difference sometimes between getting an injury and not, right? Because at least anecdotally, what we see in the withdrawal community, the highest risk period for developing the kind of protracted withdrawal symptoms, the neurological injury, is during a rapid withdrawal. I would say that's more than half of the patients, that I see in my practice have developed it that way. The rest, they kind of just emerge. So that's the most important thing. If you are not injured and you just want to come off, get the right coach that's going to follow your lead and help you come off. It could be a prescriber. It could be any kind of physician, psychiatrist, family medicine. It could be a nurse practitioner. It could be a physician assistant. They just need to know. But if you're someone that's having kind of more severe withdrawal symptoms, and we're talking someone that might be, fairly disabled by them, may have some cognitive problems and such, you want the team. So important people in that team, prescriber, of course, is important. Coach can be really important as well. Family members and friends that I would say are, wise to what you're going through. They're not going to.
This is a tricky area sometimes, right? Because we can have a whole conversation about this alone, but the fear that some others close to you might reflect and bring into your space when you are trying to do this can be actually really hurtful, and the opposite of what people need when they're going through it. So to really select those people carefully, I think is important. And sometimes, people don't have anybody and they can still do it, but it's more challenging.
I'm going to pull on that thread because I think that's really interesting and something that I've seen and worthy of kind of discussing. What's the difference between a helpful support family member or friend and one that's not so helpful? What do you see as the difference? Expand on that.
Yeah, helpful would be like, what can I do for you to help you through this? How can I be supportive to you, right? I'm thinking of my own experience specifically, but also people that I know and have worked with. And, sometimes people need just practical help. Sometimes people just need someone to sit with them. Sometimes people need someone to talk to. So somebody who's open to showing up for you in a way that's helpful. Again, this is different for everybody. But things that are not helpful for sure are people who are denying the withdrawal experience. I see that all the time. They're scared. They don't understand. They might think that it's somebody's, mental illness coming back and they need medication. So, obviously if they're projecting that wouldn't be helpful when you've made the decision, no, this is what I'm doing. Something else that would be helpful is just for people in your life to believe you. And again, ask, how can I be most supportive to you during this time? That aren't going to give you pushback and aren't going to, ring emergency when if things get really hard and, or try to convince you that you shouldn't be doing this.
There's a couple points I want to pull on there. One is that, I guess when family members get nervous or when friends get nervous, and this is different from them, they may come to you and say, tell me all about this. I want to understand and educate you. But a lot of the times that doesn't happen. Usually they just panic. And what happens a lot of the times when they panic is they're going to turn to what they consider to be, very authoritative sources of information. And so they'll say, well, you're coming off this benzo, you're coming off Xanax and you're really suffering. I mean, you must be physically dependent on it. Maybe you need to go to a rehab. And then they can kind of push you into that direction, which is exactly where you don't need, you don't need to be going. Yeah.
Right. That could be, really catastrophic. I've seen it many times. And again, this brings us back to the why, like the beginning, the reason why it's so important to know why you're doing it in the first place, to be able to, even have it written down, right? Or have a trusted friend that can remind you, like, this is why, this is your why, so you can hang in there when it gets really tough, or if you're met with, naysaying by the people closest to you. It can be hard to in a withdrawal state, to stand up to people who love you, who care about you. It's a very complex situation.
And it's, it's like hard enough having to advocate for yourself in a medical system that may not be aware of these things. If, you're being second guessed by your partner who's there with you, just saying, well, the psychiatrist thinks, this is your underlying depression and you need to take the Lexapro, and then it just, that can be terrible. So, two important things, when it comes to having a support person, it's they need to get it, they need to understand what it is and the kind of psychological effects it can have on someone, so it doesn't frighten them. Because when you're in the midst of the withdrawal and you're having catastrophic thoughts and you're saying things like, I'm not going to make it, my life is over, I'm losing my mind, they can sit there and just say, rub your back and just say, you're going to be okay. This is just temporary and you're going to make it. And kind of just calm you down.
Yeah, exactly.
So they need to know.
The supporters themselves, and this is something else that comes up all the time, and that is so important, I think, is for the supporters to get their own support, right? While they're dealing with supporting people going through it. Yeah.
And so one of the great things about working with a coach, even, all working with a withdrawal savvy provider is they can educate your family. They can make sure that they know
for you.
Because I have a lot of people asking, they kind of get sucked into the catastrophic thought chaos of their partner. And, I need to tell them, this is my general stance on it. I'm just like, the thoughts that they're having, they're coming off a brain in withdrawal. You don't really, I would not engage with them because they might say some crazy stuff sometimes, and you need to not get caught up in the thoughts. It's just like, hey, you're going to be okay. We're just surface level reassurance. I'm comfort. Here for you. Yep. And just ride it through, rather than them kind of getting stuck in, the chaos of, the person's thoughts. So
yeah, because it could be easy for that to happen. So I think you're absolutely right.
Yeah, and that's easier said than done. I know me. Sometimes, if my wife is upset with me, I'll get caught up in the reasons, but it's something completely different. It's just like, oh, you need me to be a better listener or something, and so there's all different. There's things aren't, I would say, like in a relationship, sometimes, things aren't what they seem like on the surface, and they really just need the reassurance there.
Exactly. I experienced it firsthand. But the first time I went through acute withdrawal, my husband, he wasn't great. He was almost awful, actually. We've spoken about this over the years. Like, he had to learn. And as he learned, things got better and things got calmer. He was able to show up for me and support me in the way that I needed. But it also took me, learning to self-soothe and that I was okay. And, I needed support. And once I was able to sort of feel a little like, okay, I'm not going to die. This is withdrawal. It's going to get better. And then he calmed down too. It's really, it takes both people being willing to really listening, like you said, is super important. So.
Yeah, and it's a process. So don't feel bad if your partner doesn't get it quite yet. It takes some time to stick with it.
And we have support now available that we didn't have years ago. This is all really progressing. So.
So let's think other things that people should be aware of before doing the taper. It's let's see, learning the process. So so I think learning the process is, the Aston manual can be pretty overwhelming, but it's good to have a look at. If you really wanted to kind of dumb it down, what I say, it's 5% cuts every 2 to 4 weeks in a flexible taper, typically slowing down towards the end As you may know, as you get to the lower range, the drops, they have a bigger effect on precipitating withdrawal. So you want to keep it very steady and gradual, and so you just kind of cut it down at the end.
No hard and fast rules, like, is what I usually tell people. Like, some people are able to go fast, in the beginning, and then they like just always following someone's lead, I would guess, right?
Yeah, totally. I think other things that are, that I think are important is, looking, getting your medications reviewed as well. Some medications, they can worsen your anxiety. I mean, if you're taking stimulant medications, if you're taking some types of antidepressants like Wellbutrin, that may make things a little trickier. So there's a certain way to structure the removal of other medications to make the withdrawal a little easier. That's one thing that I think is good to look at. Another thing is reducing caffeine, nicotine type products. Obviously, that helps because we're going to be purposely putting your body into a very gradual, increased state of anxiety, so it readapts. And, if you have these other, substances that cause like a roller coaster of your kind of sympathetic nervous system, it just makes it a rockier journey.
Which is also why, if you can, preparing for a taper, you can sort of start to implement all of these things with like physical and emotional health beforehand, ideally, again, right? What are some other things? Maybe, how am I taking care of myself now? Right? Is a good question. Do I have routines? Do I have a sleep? How is my sleep? Right? How am I eating? How does my foundation feel?
So tell me a little bit about the eating and the diet. What would you advise people when it comes to that?
This is hard. It's tricky because you never want to tell people, there's no like, eat this and then you won't have withdrawal. Eat this, eat perfectly, and then you won't have symptoms. But it's generally thought to be, true that if you are, maybe eating whole foods and not as much processed stuff, sugar, caffeine, all that, that your system will be in better shape to taper. So, and that could be, I mean, people are vegans, vegetarians, but I don't, whatever is right for you, I would say is right. But maybe whole foods, you're not eating a bunch of junk. You're not, living on caffeine or riding sugar roller coaster, right? Like basic things like that. But again, I'm really careful not to be prescriptive about, you have to eat this or else you won't. Because that could also get people really stuck, right? Do you see that in your practice?
I feel like generally in my practice, I deal with sicker people, and most of them have already kind of shifted towards like a low carb diet. And I guess mainly for that more of that kind of keto type diet. But I also have people who don't change their diet at all and they successfully taper.
And they and everybody heals eventually. And this is what I like to drive home to. It's it's not a make or break, but for some people it could significantly help. I learned during my process that I am intolerant to gluten, for example. It's making everything worse. It's something that my gut still doesn't handle well. So that made a significant difference for me. And then, I see it going the other way. It could cause people to kind of stress and obsess over, did I eat something wrong? And that's why my symptoms are heightened today, or, it's impossible to say though, for sure in withdrawal. Right? So what can you do? The best you can, I would say. And you have to sit there and eat ice cream sometimes. Like you have to, like, that's, when the going
that's
gets
true. That's completely true. I mean, I have patients that taper while drinking alcohol, and they're okay with it. I have other patients, that use cannabis pretty frequently, even though that's not recommended. It's like, you do you, but it can help significantly with some people. And I know one thing to consider, I think it's worth thinking about diet if you're having a lot of GI stuff going on. If you're someone that's having like, kind of alternating diarrhea and constipation, and you just kind of feel off, that might be more high yield for you to say, maybe I'm going to cut out dairy, maybe I'm going to cut out gluten, and just kind of see, and just see.
Yeah.
If you're not having a lot of problems, I wouldn't think that, oh my God, you're going to derail your taper and it's not going to work, because that's just not the case. I've seen a lot of people do just fine without changing their diet.
No, spot on. Yeah.
Okay,
and so informed consent, it just came up when you were talking about, using different things during a taper, that people use marijuana or, whatever it is, alcohol. You can provide them with what we know about the drugs and the possible effects on the brain, right? And then it's kind of in their hands after that.
Yep. And trying to think, another thing is, let's see, taking care of yourself. So, eating well.
Just thinking, sort of nervous system supporting, like the things I wish I had in place before I started initially.
Perfect. Yeah.
Nervous system supporting practices. Like, now I live by breath work. It's, what I try to teach people is the best and most, affordable tool, because it's in your body and you don't have to go anywhere for it, is, a breathing practice, meditation, whatever works for you. Not everyone likes to sit in silence, but you don't have to. There are so many different types available. Thinking about are you exercising? Are you able to exercise? That could be really helpful if that's available to you.
Just having I guess the tools in your belt for, what am I going to do when I'm, in a really kind of sympathetic overdrive state with catastrophic thoughts, and I can't kind of calm down. All of the things that Sheila just mentioned, those are the types of tools that you need to use to self-soothe, especially the breath work is excellent. We had Jen Lee on the other day, and she was talking about that kind of stuff, but she was also talking about soothing people. Sometimes you may not be able to do it on your own. The best thing is just to go to someone who's not in the chaotic mind state, who could just, hold you. It's okay. So there's going to be all of these different tools.
Absolutely. Yes. I couldn't do it during my first taper. I didn't have that in place. I had one person that I would see, and I would only be able to sleep on the nights that I saw her. She was kind of she would do music therapy and all kinds of things, but she was soothing. So it's like, find those people if you can. Yeah.
So I think this is, we've kind of touched on the main points. I think that this is a good overview of the things that you should keep in mind if you're embarking on a taper. I guess one other point, which I'll add on just quickly, and, this is more for the people who have the protracted injury, they rather than someone who's coming down gradually. What I see with the people who have the protracted injury, and what I think is important for you to understand, is that sometimes it has a life of its own. The symptoms aren't linear, and so they kind of go up and down, up and down, up and down. And one thing which is really important to keep in mind is just that you remember that, because otherwise, just like Sheila was mentioning, you start to think, you have a flare up one day and you're like, oh my God, it's because I ate this food, or, it was because I, dose reduced as well. The dose reduction is too much, even if it was like a 2% reduction.
Right.
Just being aware that it's going to be a rocky ride on the way down, and to not kind of get caught up into too many of the things and make these associations, because you can drive yourself crazy doing that. And
absolutely. And we do, and I have, and I probably will again one day. And it's just like, again, why support is so important. Like having people remind you. Sometimes I've been doing this for so long, and I still need reminders. Like it's, part of it. So the non-linear, right? It's so important to reinforce that thing. I totally agree. Yeah.
So I think we are. I think this is a good place to end. Sheila, it has been a pleasure to have you here. I'm looking forward to talking again. And this was great.
Thank you so much. It was great to chat.
Please comment down below as well in the video, what topics do you want us to cover? We will kind of try and do this fairly frequently, and anything that you put below is fair game, and we want this forum to kind of help answer these questions. So great. Thanks everyone for listening. Thanks, Sheila.
Thank you.